COVID has made us really be aware of our immunity and how this is related to our health. Before this, I think a lot of what we had been experiencing in terms of illness, we had been having more of lifestyle diseases. But once again, we're really focusing on our immunity. But so health is not just about resistance to the disease, but also how we live a healthy life. And this is why I chose this topic today, which is yoga and health, really looking at the aspects of COVID and other ailments. And I'm really excited today to have a fellow yogi and a doctor in health psychology, Dr. Anitha Menon. Thank you very much for sparing time. I know you haven't got many minutes to be with us. You are rushing off to a work call and you really just made time for us. So please go ahead and share what you have. I'm really interested to what you have to say. I remember the very first day I met you in game, your husband had seen me with a yoga mat and he was like, do you do yoga? And I said, yes, I do yoga. And he says, come, please come and meet my wife. So I'm so grateful to your husband for introducing us, and says she's doing some research on yoga. And the topic is amazing. I remember the topic up to now, even though that is almost 9 years ago, and you were researching how yoga affects the immune system of HIV positive adolescents. So over to you, Anitha. And you just have to unmic so that we can hear your beautiful, calm voice over there.
Sorry about that. Yeah. Okay, so namaste to all of you. And thank you so much, Towani, for the opportunity to speak about a topic that I'm really passionate about, that is yoga and health. So I am a health psychologist. I work at the University of Zambia. And when I say I'm a health psychologist, it means that I am studying the interaction of human behavior, thought, and feeling with the physical health. So that's what I do. And I'm saying this so that you understand my bias throughout the presentation that I am making. So the relationship between yoga and immunity is primarily through the stress response of the body. And usually when making a talk of this nature, one would go on to defining what is stress, but I'm not going to do that. A, because it's boring. B, because I can spend the whole time and still not completely define stress. So it's a very complex topic, and it is almost impossible to cover all of this in a very short time. But I'm sure that all of us have experienced stress, and we know what it feels like to be stressed. I was once approached by a health insurance company asking me to do a stress management training for their clients. And the reason that I was given was they were getting a lot of claims to do with illnesses related to stress. So what is being implied there is that stress compromises the immune system and thereby increasing one's vulnerability to developing certain illnesses. Please don't misunderstand or be fooled that the health insurance company is concerned about making our lives stress-free. No, that's not their agenda. What they want to do is to, of course, reduce their claims. Okay, but one practice that I can vouch for that you can adopt to deal with stress is yoga. And this in turn will also have a positive effect on your immune functioning. So we know that stress is a part and parcel of our everyday life. There are so many issues around us which stress us, the family, the work, and nowadays the COVID-19, which is a constant stress to all of us. And those of us who are constantly on phone using WhatsApp know that even if you do not have Wi-Fi for 10 minutes, you can get stressed. So it happens all the time. And of course, it is the individual's perception that has a lot to do with their stress experience and how their body is going to react to the stress. For example, in a current situation where our life almost seems consumed by this COVID-19, of course, we do feel stressed. It is natural. It's natural for us to feel stress. It's an uncertain situation, a new situation that we are facing, and of course, we are stressed. But how much stress we experience will depend on how we perceive it and can take control over that situation. So I'm just going to try to bring up my screen, but there is a very famous neuroscientist called Stephen Meyer. And according to Stephen Meyer, he says that stress is a form of infection. So what exactly does that mean? It means that stress causes changes in our body. And during stress, the body reacts in certain ways so that we are able to cope with stress or to deal with the stressful situation. For example, you may find that your heart is beating faster. Why does that happen? It's because there is more blood being pumped and circulated to all parts of the body so that we are able to act in certain ways and to deal with stress. But when we experience stress for a long period of time, then it becomes a chronic stress, and that's where the problems begin. That's where your body gets affected, your immune system gets affected. I prefer to call yoga a science of well-being. And this is because it's an ancient practice. We know that in yoga, we do breathing exercises, different asanas, and all of these facilitate relaxation and reduce stress. And there is scientific evidence to suggest that regular and consistent practice of yoga improves mental as well as physical health. Even world-renowned educational institutions like Harvard have published about the positive effects of yoga. And during the COVID-19 time, Harvard actually recommends practice of yoga to deal with the COVID-19 anxiety. So how does the practice of yoga actually help? Yoga is found to be useful to calm and relax the individual, and thus reducing the blood pressure and also being able to better deal with stress. When we are calm and relaxed, we are, of course, able to deal with stress better. And stress affects sleep and our concentration. And when we do not sleep well, or we cannot focus on activities, then we are more prone to accidents. And again, scientific evidence suggests that yoga improves sleep and concentration. Under stressful situation, the stress hormone known as the cortisol, the level of this hormone remains high in the body. And this leads to certain health consequences due to the adrenal fatigue that the body is experiencing. And some of the consequences are high blood pressure, insomnia, and compromised immune functioning. And that's what we are talking about today. So the stress compromises the immune system as it lowers those cells in the body which defends the body against infection. And when we practice yoga, it improves the immunity by regulating two hormones, the cortisol, which is the stress hormone, as well as serotonin, which is known as the happiness hormone. So it's quite interesting that serotonin is produced by a very small part of the brain, the raphe nuclei. And this is so small that I don't even know how to say it in terms of percentage. It is 0 point followed by 5 zeros, 15%. So it's that small part of the brain. But our brain is not a democratic brain. So even that very small part of the brain has a huge effect on how we feel and our mood itself. And so in a research that I carried out with HIV positive adolescents, so this was carried out quite some time back. So in this research, I used yoga with this HIV positive adolescents to, they were in the age group of 11 to 16. And I wanted to find out if yoga, together with certain other interventions that I used, whether yoga on its own had any effect on the immune functioning of these participants. So what was found was that after a period of 10 weeks of yoga, regular yoga, which was practiced in a group, it was found that their immune functioning, and we measured immune functioning through the CD4 cell count, had improved in the group which practiced yoga. And the participants who were involved in the yoga group also rated their physical health to be better than it was before the start of yoga. So this is self-rated. And you must remember that this doesn't mean that you should forget everything else involved in the HIV therapy and just go for yoga. Yoga is only a complementary therapy. Together with everything else, together with the medication, the art treatment, when you do yoga as well, it has an increased effect on the immune system. So that's what it means. And during the yoga session in this research, we did breathing practices and physical postures or asanas. So every day we did 2 asanas, each from the standing, sitting, prone, and supine positions. And the session ended with deep relaxation. So like I said, this research was carried out about 10 years back. But since then, there have been many researches that's been carried out all over the world showing the effect of yoga on the immune system. And recently, one of my PhD students also used yoga in the Zambian Correctional Services and found that it had a benefit on the health of the inmates in the prisons that he was using this intervention. So some of the yoga postures, I'm sure Towani will talk about more postures, but some of the easy postures to do would be the bow posture, the tree posture, and the sphinx posture. These are found to be very effective in improving the immune functioning of the individuals. There are various other postures as well, but I personally like these three postures, even when I'm teaching, because it's quite easy for even those who haven't practiced yoga for a very long time. So thank you very much. If you do have any questions or you would like to get in touch with me for more information on my work, please, you can email me, and namaste.
Thank you very much, Anita, for your scientific view. And there were some things there that I didn't know. Really interesting that even the Harvard Medical School is recognizing yoga and putting out even some guidelines. Now I know that you have to rush over to your work meeting, which you graciously delayed you entering that meeting so that you could be here with us today, and I really appreciate that. So if you need to go right away, then go ahead and get going. But if you have a moment and would like to add anything, or if there are any questions, you can ask us some questions. You can see some.
Yeah, I'll hang in here for a few minutes as the participants for the other meeting are joining in. But I'll even when I'm on the other meeting, I will still be online. I'll just be off video and muted.
It's great. I remember a friend of mine talking about how, with Zoom, with this online thing, she was very cheeky and she attended 2 meetings at the same time, which I thought was really cheeky. But that is something that is so possible with this new technology, which was not possible physically, right? You can be in 2 meetings at one time. So I'm glad we've still got Mumba over here, Dr. Chalwe-Kaja with us. And I'm just going to talk about it a little bit more from a lay point of view. If you have any questions, just type them in the chat. I'm hoping that I can see what's going on in the chat. I'm not quite sure if I can see the questions, but I'm not seeing any questions at the moment. I will just ask my production manager on the other room to just alert me if there's any questions that come through on the Facebook feed. I've got 2 screens in front of me. This is why you see me looking from left to right. Right, we have a question here from Sarah, and she says, what about those poses, bow, sphinx, and tree, that make them great for immunity? Well, I will say about the bow pose that it is really working the internal organs. It is really working with the kidneys and the digestive system, and that will help with our immune response. Maybe Dr. Kaja later will talk about why is it that poses that are working the abdominal system would help release the stress. Definitely the long relaxation or the shavasana she spoke about, Dr. Menon spoke about at the end, would release the stress levels. The balance, the tree, I would say, would help with stress levels in the sense that you need to be deeply present and available when you do tree, and in particular, but all poses, but particularly any balance pose. And tree is just an easy balance. You have to not have your mind preoccupied with other things, and this is where the stress happens. So a pose that brings us very much into this moment, and balances will do that, would be beneficial. Now I'm going to give a really short presentation, just 10 minutes, and then we're going to open it up for any conversations that we have here, any questions that people may have. I'm just going to ask my production manager just to put a comment in the group, in the live feed, and see if I can see it. I'm a little bit suspicious of my iPad over here and whether it's giving me a good reflection of what's going on. I'm going to share my screen right now, and I want to go through a short presentation that I gave a couple of weeks ago at the Anakazi business conference, Arise business conference, about yoga and health, and in particular health generally, but a little bit more thinking about COVID, as this is really in the forefront of our mind, as well as other ailments. So you may be like, what is yoga anyways? So as Dr. Menon said, it is an ancient scientific practice, I would say. But the word actually yoga in Sanskrit means union or joining or bringing to one. So what you will find is that the poses, the positions, and the breathing exercises and the meditation that we find in a typical class help bring us all together, join us in our body, our mind, and our spirit. When we're stressed, we tend to be a little bit scattered, I would say, at best. You find that the body is present here, but you're worried about something that has happened or fearful of something that will happen in the future. And when we live in that kind of disjointed, fearful way, it really does increase the stress levels, which are not great for our health. So yoga is really about that union or oneness in our individual lives, within our own bodies, minds, and spirits, but then also connecting us. It's also about how do our lives join and how are we one with other people, with other beings on this planet, and indeed the whole universe. Now you're like, what's that got to do with stress? I think we really get stressed when we feel isolated. And this is how the COVID situation can be an added stress, because we're not able to connect, particularly in a physical way. We are fortunate that we're able to connect now with technology, but not everybody has that luxury of internet and all these devices. In many third world countries, and definitely back home in Zambia, we don't have that option. So this increasing isolation that we are experiencing, and the modern life, I think, disjoints us, takes us very much out of the community way of living that we have lived in for many years. And this disjointness between us and all living things, I think, is really at the root of the environmental crisis that we're experiencing at the moment. Climate change, they say the sixth extinction level. We are wreaking havoc on this planet, which is not just bad for all the other living beings, because we're all one. We are actually going to be the ones that will suffer. The rocks and the planet, Mother Earth, will probably be very fine without that. So you can see how yoga and this mindset, it's very much a mindset, can help us. So why is this topic close to my heart? It's because I have my own personal COVID experience. I had moved to the US in February of this year, and it was just 3 weeks into the marriage. My husband is a futurist, and he had spoke at a conference where there were 400 plus people. So you can see, in a closed room. We didn't know that at the time because this was the early days, but now we know the risks. And a week later, he developed a fever and fatigue. And that's when it dawned on us that, this could be COVID. But the situation was right in the beginning, we couldn't get tested. And he was losing weight, he was fatigued, the fever continued. And after a week, which was really scary, he started getting out of breath. And just as he was getting better, I started to get ill. My symptoms were not as bad. I think we know that the symptoms are different. I really had body aches and sore throat and the lack of energy. So it was stressful being sick, but even being more stressful because of not really having the support in terms of the hospitals and not having the tests available to know what was going on, although the emergency facility was actually there. So this leads us back to what Dr. Menon was saying, and I'm going to put it in a little bit more lay times. we all know about the stress response or the fight, flight, or freeze system. So when we're in a stressful situation, we want to fight. I mean, this worked, I guess, as we were evolving when we were confronted maybe with a lion, something that wanted to eat us, or a warring group. We could fight if we stood the chance, or we could fly away, or we could actually freeze while we're kind of figuring out what to do. Now, this is not exactly very helpful when you are facing a virus, right? You can't really fight it, have a boxing match with it. You can't run away, and you can't really freeze. But I want to talk about some of the effects that the stress, when we're in this stress response, when the adrenaline is running through our body and the cortisol levels that Dr. Menon mentioned are increasing in our body. So what you will find is that the energy goes into our muscles. So what it means is when the energy goes into our muscles, it means that our muscles get very tense and our heart beats faster. And I think Dr. Menon mentioned the heart beating faster. And this is all to prepare us for running away or fighting. So this is the reason that our energy goes there. And as I said, that could be useful if we're facing a lion or attacker. What it means, and this is why it's not useful for us at this time, is that the energy goes out of our digestive system. It goes out of our immune system. So this is not great for us to have all of these areas to be without energy. And the implications are pretty evident. What you will find is when we are in this fight, flight, or freeze method, which is what we don't want, we have less energy in our digestive system, our immune system, and our reproductive system. So yoga comes in really to help us move now to this system of, I call it feed and breed, or the parasympathetic system, where we can have more blood and energy in our digestive system. Because if we're in stress situation, you'll find that we are not making good use of our food. We tend to bloat. Sometimes it's not about what we're eating that we bloat, but really about the fact that we are stressed when we're eating, or we're stressed when when we are digesting our food. Our immune system will get weak because the energy is not it, and we notice that we tend to fall sick when we have some stress in our life that immediately lowers the immune system. And when the immune system, when we are stressed, then it also means that we have issues with our reproductive system. Maybe our periods could get disturbed, less likely to get pregnant. And this is a topic that we're going to speak about another time. We'll talk about that at the end. So how yoga helps is really to release that tension. So a lot of the poses that Dr. Menon showed are great to release the tension. You stretch out the muscles that get tight, and it also helps with the hormones. The bow pose, which was shown that one is very good for balancing the hormones in the reproductive system. Child's pose is very relaxing, releases stress, and also helps balancing the hormones. And posture, there's that reverse body language. We feel better when we put our body in a better position, and yoga will help us be in a better position in our bodies, which will help lift our mood and maybe get us a little bit out of the stuckness that we have. With better breathing, we do a lot of focusing in yoga. In breathing, you'll find that the blood pressure tends to lower when we breathe deeper and slower. As Dr. Menon mentioned, one of the stress responses is that the heart rate goes up, and when the heart rate goes up, then the breath rate is going to go down. And of course, it keeps us nice and fit and toned and flexible, where we have more stamina, which means we can take on a little bit more, especially in terms of the physical rigors. So you can see how yoga is helping the body, but also in the mind. Once we have increased awareness, we are able to release any tension, and we're able to check any of the negative moment, negative attitudes that could be stressing us. And yoga very much keeps us in the moment. And most of our stress is remembering something that happened in the past or imagining something that happens in the future. The slower we breathe, the slower the mind, and the more relaxed we'll be. I would also say that yoga helps the spirit. And the spiritual world is a tool that can really help us when times are hard. The deep breathing and the meditation and the silence can help us go inwards, and we can tap into these resources. And this doesn't matter what faith we have. It's irrespective of what faith we may have. This is open to every faith. Almost every faith will promote some sort of meditation or sitting in silence. So here we have it. All it takes is a breath. All we need to do is just relax, and we can take that deep breath. In fact, join me right now. Take a deep breath in, mind the gap, sitting nice and long. And exhale, totally release. Release the shoulders and try to let go of any tension. And maybe in that one breath, you can feel the difference. And if not, just do it again and join a yoga class. Join whichever yoga class is most convenient for you. There's so much that is going on online in Osaka. I know there are a few classes going on. The Katuta yoga classes have started in Kabalonga. There's also the French school. There's also other classes going on. But if you're not able to get out or the times don't agree with you, there's lots of YouTube channels as well. But do feel free to join the Katuta online classes at aa.namastream.com/Katuta yoga. You will also find these details on the Katuta yoga page. And it's free for now. We are probably going to launch in September. So you're very welcome to join the 3 live classes a week, Monday, Wednesday, and Friday, 18:50 Zambian time and 9:50 where I am here in Denver. And lots of recordings. There's over 30 recordings there that people can take care of. So that's all I had for you in terms of just giving you an overview. And I'm gonna, I think, stop sharing my screen. I hope I am trying to just understand what is happening on my page right now. I hope I'm getting it right. Thank you very much for the comments. Nice to hear that Mwanalute is good. Thank you. You inspired me to do this topic with the Anakazi network over there. I'm glad that Princess Kunda has joined in, Namonja has joined in, and Cristobal has also joined in. And there are some questions, and I invite Mumba, Dr. Chalwe-Kaja to unmute and give us some of your experiences. The question that we have, first of all, and Mumba, maybe you can also help with this, is based on the studies, how often should one do yoga and how long before we start to see the benefits. But what's your experience? You started yoga a number of years ago, and as a doctor, you guys lead pretty stressful lives. I remember you sort of rushing to come to class from UTH and like, okay, I just need to do yoga. It's been a stressful day.
Yes.
Would you like to talk about how yoga has helped you with your stress management? And
thanks so much, Tawani. It's so lovely to see you. I have missed hearing you, seeing you. So this is really good that we can link up like this. If you remember well, my yoga journey started in Lusaka, outside in the little hut. And that was all I needed, because at that time I had started a really intense surgical program that required long hours, standing for long hours in surgery. I don't know if you remember me asking you, what poses can I do to get this lower back pain to go away? And just, it was a very, stressful time for me, a very stressful point in my career. I used to work really long hours with really sick people. That was the referral hospital for the country. So you can imagine the burdens. Yoga for me really helped center me, because the stress wasn't going to go away, but how I reacted to or responded to the stress is what yoga helped me gain control over. I found that I was more adapted to my situations. I was more grounded. I could actually, even during, for example, long theater cases, I'm able to withstand 6 hours of surgery. I'm able to withstand, longer hours of surgery, which have improved, by the way. I don't do that anymore. I don't need to. But that time in my life was really made easier from my practice of yoga. Even for things that I couldn't do much to change the outcome of the situation, I was able to control my response much better through mindfulness, breathing, control my responses. I was able to have a better working environment simply by being more conscious and more aware. And those are things I do even now. My hours of surgery have decreased. My work in terms of physical demands has decreased, but the mental demands and the emotional demands are even higher. So the practice of yoga really helps you center your mind and just be in the moment, because especially with COVID and we're doctors, this thing is cutting across all fields, subspecialties. So we're all affected, and something as grounding as yoga, you wouldn't believe how the practices from yoga really, they spill over into my daily life. And I really would encourage, all of us to really take it seriously, because it's such a useful thing to do. You actually do see results. For me, within the first week, I changed my posture, tuck my pelvis up, hold my posture, keep my spine aligned. I was more aware. And those are things that I haven't lost, regardless of moving halfway across the country. And Towani, my yoga instructor, is gone, so you so you find that those are habits that you don't lose along the way. You find that I'm able to do yoga with my two toddlers. They get down in downward dog with me, and those are things, it's bonding for the little ones and me, and it really helps you, relax after a long day and focus when you need to focus. It just works. And the small changes, the small changes that you make by practicing yoga, things like breathing deeply. I'm now more aware of how I'm breathing, things like my posture when I'm, say, operating. I've actually started taking note of those things. I recently started running, and the principles from yoga actually help you become a better runner. So you can actually take this into so many aspects of your life. And I know the topic is about stress, but I thought I could just share a bit of my experience, because my whole world is stress, is a ball of stress. So these are just things I do to stay sane and stay grounded and be able to function and still have enough of me left to give to the people that need me, my family, my patients. So it's really, for me, I swear by it. It's not a practice of yoga. It's more a lifestyle, if I can say. It's learning the methods, and like you said, it doesn't matter what faith you are. It doesn't matter, what disposition, what dispensation you may be. These are just, it's a way of healthy living that you can see tangible results with. And for me, that's what's important. It's something I really would like to share with everyone around me.
That's great. I'm really encouraged by what you said, and it answers a question that we have on the Facebook page from Cristobal in terms of, when will I start to see the results, and how often should I do yoga? And you are talking about seeing results even after 1 week. You are able to see, I mean, the postural things that you do once you instituted those postural things, those ones I know that you felt even within a day or so. Because when you're sitting, you're standing 6 hours, just that, it's like tucking the pelvis, engagement of the core, and minding the gap, that would give you, immediate
instant
release. But yes, after a week. But I will generally say a month. I would say if people are regular attending class for a month, then they will see some, pretty substantial benefits. How often do you manage to practice yoga now? I know you've got a pretty hectic lifestyle over there. Being the first urologist that we have.
That vibe follows me everywhere.
Yes. How do you?
Of late, what I found is I didn't have specific times when I could go for a full 1 hour yoga session. I did find 2 groups right here locally that were doing yoga, but with COVID, a lot of it has gone online. And the live classes, I just never seem to catch them. So what I do now is before I go to bed, I do have a small routine that I do. And I also tend to do my Shavasana. You sent me one and I still have it. So yes, I do like to do that. It really, especially when I'm getting anxious and getting very stressed, I do that almost, I can't even put a timetable on it, twice a day. I do have my mindfulness. I have started actively doing a little mindfulness session with myself, the body scan. I think that's what we call it, where you just scan and see, okay, what is it? Where am I? Ground myself in the present. So it's, like I said, it's not something I can, am I there? Oh, okay. I lost everyone for a moment. It's not something I can pinpoint and say, I do this twice a day, or I do this. It's become very well-being.
So you've incorporated it into,
when I start to feel anxious, I'll slow my breathing. Yes, that's what I've a few poses.
You've incorporated it into your daily life, right?
Yes.
And that's very important. I think you have attended enough yoga classes now that, as you say, you have a few poses, you have a routine, and I think I've seen that even 20 minutes of yoga, even 15 minutes of yoga at the end of the day or at some point in the day can make a huge influence to one's life, especially if it's, I mean, I think when one does one class, one feels, one thing I find and is that after a class, even though I'm the one teaching the class, I feel I have more energy. I don't know how you feel. I'm relaxed, but I feel I have more energy. Whereas, stress, and before that, I feel that saps my energy. Whereas I feel that yoga brings it up. If you had to talk about one major thing that has been the biggest benefit of yoga, Mumba, what would it be?
Um, I know we're talking about a lot of times people are looking for actual physical, tangible change. But for me, it's about my ability to bring myself back to center, because a lot of anxiety, especially with COVID, a lot of anxiety, a lot of unknowns. The simple breathing and mindfulness, being aware of where you are and bringing yourself back to now. For me, that's the biggest thing, where I'm not worried about, are you going to get a COVID infection? Am I going to get a COVID patient? I stay in the now. Right now, I'm doing XYZ. I'm going to finish XYZ. It will be successful, and we'll close that chapter and we'll move on to the next thing. That's the biggest thing for me. That's the biggest thing.
I think that's great. I think a lot of the time a lot of people start with the physical benefits, but as you go deeper into it, you find that the benefits are in other areas that you hadn't even thought about it.
Yeah.
And then when we think of not catching COVID or other infectious ailments, we tend to get very technical, like wear a mask, which is important.
Yes.
Wear a mask, wash hands, maintain social distancing, and try not to be in crowded places. And all this is very important. But I'm really amazed by the body's ability to resist things. Because what you find that is in a certain place, many people are in a place and in same circumstances. One person will get the infection and another person will not get the infection. So I think we need to take a deeper look at our health in general. Because I think if we really look at our immune response is an overall view of what our health is. So it is eating right, it is exercising enough. But the biggest thing is, even I find with myself, I'm eating right sometimes, I'm exercising, but I get sick when I get stressed. So I think that's the missing link that a lot of us are not talking about in this whole equation of COVID. If anything, I think people are getting more stressed in this situation and more likely to catch it, because not just COVID, but this goes across infections across the board. And when we're talking about stress, we are also talking about the lifestyle related diseases as well. They are also very much
yes
with stress levels, particularly high blood pressure. But that is going to be a topic. I want to just give you the last few words, and then we talk about the way forward.
You said something that reminded me of something I was talking about with my husband. He's an orthopedic surgeon, and he told me a very shocking statistic. Did you know that only about 30% of back pain, chronic back pain, is actually pain? The other 70% is secondary pain from stress, from psychological unhappiness, people who are unhappy in their marriages, in their work, in their relationships. And that really got me. I was shocked. And, he smiles and says, look, I see lots of people with back pain, but more than half the time, the problem is much deeper than a muscle or a bone or whatever. And it reminded me of my stress pain, the tension in the neck. Mm-hmm. When I'm stressed, when I'm being overly agitated and anxious, you find that you get a lot of pain, and that just speaks to how our bodies react to our internal environment. Mm. So the practice of yoga is one thing that's, it's free, it's readily available. You can do it anywhere. You can do it, you don't need anything. You can just, start the practice. So that's something you can use to combat a lot of these things. And I find that that's a first step to living a healthier life, is to to control your internal environment as much as you can. Control your internal, because the external environment is very variable. There's so much that goes on around us. And if you can't get a grasp of your internal, the ailments now just start to, and even when you have a simple thing that can be treated medically, it becomes exponentially difficult if your internal environment is not well controlled and well managed. So I think that's my final remark, would be to say that we have to take charge of our own health. As a doctor, I have sworn my life to help people and to help people live healthier, happier lives. But ultimately, it's up to us to take charge of our own internal environment, our own internal well-being, and that will help. It goes a long way in protecting our bodies from these external agents that can actually cause harm to us.
Thank you so much, Mumba. Please, greetings to Simba, greetings to the other Dr. Kaja, very interesting couple. Love both of you, and you're beautiful. I told you your sons are too pretty. They could be. I don't know what they like now. But what Simba says is very true. 70% is really in the mind, and the mind is in us. So we can see that at least 70%, and in fact, you could even argue that the 30% that manifests in the body could have started in the mind, is, we can't control the outer COVID situation, but we can control. A lot of us have the ability, the opportunity to work with what's going on inside of us. Now, this is the first of the series in monthly talks. I wanted to take yoga outside of its little niche and show how yoga is really much related to so much of life and the various aspects of life. And I know that I brought you in this month in a very general position as a yoga practitioner yourself and just as a medical doctor. But your speciality is urology and very much in the area of the reproductive system. So for next month, on the 24th of September, which is the last Thursday of the month, I would like to be holding these talks monthly, and the last Thursday, I would like us to talk about yoga and the reproductive system, which I know is right up your street. So we talk about yoga in relation to sex, yoga in relation to fertility.
My favorite topic.
I know, that's my favorite topic. Yoga in relation to menopause as well, because over the years, at least every year, I would have somebody come up to me in the class and say, I'm coming to yoga because I would like to get pregnant, for instance, and I am, have tried and things are not working out, so I want to try yoga as an avenue to help me. And I know yoga doesn't help with everything, but I will tell you that every one of those women ended up having a baby, so there must be something in there. So thank you very much, Dr. Mumba Chalwe-Kaja, and thank you very much, Dr. Anitha Menon, and thank you everyone who has taken part, and look forward to seeing you in class, hopefully, whichever class you want to go to. And other than that, we'll meet next month for our topic on yoga and the reproductive system and how this affects sex, fertility, and menopause. So this is Yoga Sensei Towani Clarke signing out, and we'll sign out in yogic style, which is Namaste.